anafanya nini?
Turning to our COVID situation today, we have recorded the highest number of positive cases since the pandemic struck in our country. I say that with some level of qualification because today we have tested a sample of 6,024, and among these samples we have found 213 positive cases. The qualification I refer to is that you can note that the 6,000 is a large number. I think it's probably the largest one-time number that we have tested. And the positives, 213, also looks high. It's the highest we have recorded, actually. But we must also look at this in the context of the number of samples that we have tested. So if you look at it as a ratio, we have been testing approximately 2,000, roughly 2,000 samples a day. And this is what has taken us to the 3-digit figures of 100 and just above 100. If you look at it in that relationship, this number is not that alarming because it still translates to about that level we are seeing of about 70 positive tests for every 2,000 tests tested. The reason why the number is huge that we have tested is because, if you will recall, we have told you before that we had some backlog of samples which came up because we didn't have the reagents. We now have the reagents and we've been able to clear up this backlog, some part of this backlog, which accounts for the large number of samples tested and gives us those number of positives. This now brings to 4,257 the number of positive cases in the country. And the cumulative number of tests that we have carried out so far is 130,498. Out of the positive cases, 198 are Kenyans, 15 are foreigners, and in terms of age, in terms of gender, 151 are males, 62 are females. In terms of age, the youngest is 1 year old, the oldest is 73. By distribution in the counties, Nairobi, as I alluded to earlier, leads with 136 cases, followed by Mombasa with 32, Kajiado 13, Kiambu 7, Busia 5, Nakuru 4, Machakos 4, Garissa 3, Isiolo 3, Taita Taveta 2, Kitui, Migori, Narok, and Embu have 1 case each. The distribution of the new cases by sub-counties is as follows. The 136 cases in Nairobi come from Dagoretti North, 36, Westlands, 25, Kamkunji, 17, Kibra, 13, Makadara, 11, Starehe 8, Langata 9, Kasarani 6, Embakasi East 4, Embakasi North 3, Ruaraka 3, and Embakasi Central 1. Second leading county is Mombasa, and the cases today come from Mvita, 20 cases, Likoni and Kisauni, 5 cases each, Changamwe 2. In Kajiado, the 13 cases are from Kajiado Central, 7, Kajiado North 5, and Kajiado West 1. In Kiambu, the 7 cases are from Ruiru 4, Kiambu Town 2, and Lari 1. In Busia, the 5 cases are from Teso North 3 and Teso South 2. The Nakuru cases are from Naivasha 2 and Gilgil 1. Machakos cases are in Athi River, 2 cases, and Machakos Town, 2 cases. In Garissa, the cases are from Dadaab 2 and Garissa Township 1. In Isiolo, the 3 cases are from Isiolo Town. The 2 cases in Taita Taveta are from Voi. The 1 case in Kitui from Kitui South. The 1 case in Migori from Suna East. And the 1 case from Narok is from Narok North. And the 1 case from Embu is from Manyata. On a positive note, we have today discharged 106 patients from our various hospitals, bringing the total cumulative number of recoveries to 1,459. We continue to appreciate the good work that our healthcare workers are doing out there. At the same time, regrettably, we report that we have lost 10 more patients to the disease. This is the highest number of fatalities recorded on a single day since the first case. And this brings to 117 the number of those who have succumbed to the disease. I want to send my heartfelt condolences to the families and friends of the departed.
In terms of the deaths, we reported 10 deaths today. 9 of these deaths occurred in health facilities, 6 at Kenyatta University Teaching Referral and Research Hospital, 2 occurred at the Coast General Hospital in Mombasa, and 1 in Nairobi Hospital. And of course, I told you about 1 community death in Kiambu. That tells you that our health-seeking behavior is changing. Many people are going to the facilities. And this is not an indictment on the treatment of these particular cases. Remember, there's no cure for COVID. The treatment is basically supportive. So if you come and you have respiratory failure or you have kidney failure, basically the role of the doctors and nurses and the laboratory people is to support you throughout that period and hope that you are able to pull through. I'm confident that even though we lost this number of people, these deaths occurred in facility and they received the best care that we could be able to afford them. In terms of the proportion of the 6,000, what came from the backlog, we had a backlog of just about 5,000 tests. So for today, maybe about 1,000, 1,500 could have come from the backlog. And I'm glad again to report that we have now since cleared the backlog of tests. There is always danger that if you have a backlog like that and somebody tests positive, after you have kept the specimen for 3-4 days or 1 week, and the person is moving around, of course, there's always that risk that he or she would be able to transmit the infection to other people. But what else could we be able to do? There was nothing because we didn't have the test kits to be able to confirm. What we pray and hope is that the global supply chain pipeline will get better and we'll have consistency in the test kits that we continue to get. There was an issue about transmission and contact tracing. It is usually very, very difficult to be able to do contact tracing once you have established community transmission. So linking somebody with a contact becomes very difficult and it becomes very, very expensive and tedious and tiring for the healthcare workers. So then you shift your plan from doing contact tracing to basically trying to contain the spread of the infection. Out of these 10, 7 of them, out of the 10 mortalities reported today, 7 of them had underlying medical conditions, with 4 having diabetes mellitus, 1 having hypertension, 1 had chronic myeloid leukemia or bone cancer, and 1 had HIV. And I think this is the second or third HIV COVID positive case that we are reporting. Studies from South Africa have indicated that those who are taking the ARVs appropriately are able to achieve viral suppression. So it is again our call to those who are on treatment to ensure that they adhere to the treatment. Our health facilities are available, open 24/7. Please go for your prescription refill. The healthcare workers are properly trained, they are properly geared, and they are safe. So don't fail to take your medicine because you fear getting COVID. Because if you get COVID-19 and you're not taking your medication, it's like you are sentencing yourself to death. Thank you.
Do you have the technical person? Maybe explain. Yeah, yes, please.
This is just a ventilator.
Oh, okay.
COVID-19 restrictions, do you think then this will accelerate the numbers even more? Facilities in the counties, have they been set up yet or not? Thanks.
What does this mean in terms of preparedness, in terms of now when it comes to refugees, not only even in Dadaab, but also in Kakuma as well? My second question, Mandela.
Je, mtindo huu bado unashuhudiwa ama watu wameanza kwenda hospitalini hivyo basi?
Patients to go back home to create room for the new patients who are coming in. And while on the same for Dr. Amoth, there's a concern about the asymptomatic and pre-symptomatic patients where